KCI VAC Simplace Dressing Bridge Application. The VAC therapy system is indicated for patients with chronic, acute, traumatic, subacute, and dehisced wounds, partial thickness burns, ulcers such as diabetic, pressure or venous insufficiency, flaps, and grafts. This video is intended for clinicians. Prior to use of the VAC therapy system, consult detailed product instructions and important prescribing information contained in the KCI VAC therapy clinical guidelines and the device or disposables specific user's guide. Additional safety information specific to the VAC therapy system is available at the end of this video. Contact your local KCI representative or call 1-800-275-4524 if you have any questions before initiating therapy. Bridge application with VAC Simplace dressing. Dress the wound as previously demonstrated up to the point that a hole is cut in the 3M Tegaderm dressing. Place additional 3M Tegaderm dressing over intact skin in the area where the bridge will be applied. Beginning at the larger end of the foam, cut or tear a piece of VAC granufoam to the appropriate length for the bridge. Place smaller end over hole in 3M Tegaderm dressing and ensure that dressing foam contacts bridge foam. Cover the bridge with 3M Tegaderm dressing. Pinch 3M Tegaderm dressing and cut at least a 2.5 centimeter hole at SensaTrack pad application site. Do not cut a slit or an X as it could self-seal. Remove backing layers 1 and 2 from SensaTrack pad. Place SensaTrack pad opening directly over hole in 3M Tegaderm dressing. Apply gentle pressure to secure. Pull blue tab to remove stabilization layer. Connect SensaTrack pad tubing to canister tubing and open clamps. Turn on power to the VAC therapy unit and set to the physician-prescribed therapy settings to initiate therapy. VAC therapy is contraindicated for patients with malignancy in the wound, untreated osteomyelitis, non-enteric and unexplored fistulas, and necrotic tissue with eschar present. After debridement of necrotic tissue and complete removal of eschar, VAC therapy may be used after hemostasis has been achieved. VAC therapy foam dressings should not be placed directly in contact with exposed blood vessels, anastomotic sites, organs, or nerves. Do not place any foam dressing into blind, unexplored tunnels. The VAC white foam dressing may be used with explored tunnels. Instructions for use and safety information. As with any device, it is important to read and understand the detailed instructions for use and safety information, including information on bleeding, exposed vessels and organs, and infection, applicable to your VAC therapy unit and dressing application that can be found within the therapy unit, disposables carton, or in the VAC therapy clinical guidelines. www.kci1.com. These sources provide information concerning the proper application of all VAC therapy dressings, including advanced applications and techniques. If you have product questions, please contact KCI at 1-800-275-4524, option number 3. KCI offers device training upon request.